Now, we're going to get kicked off with a consultation which is going on in Northern Ireland at the moment. This is entitled Public Policy Proposals to Inform the Development of a New Public Health Bill for Northern Ireland. The consultation opened on the 5th of July this year and it closes on the 27th of September. So thank you to the person who sent this through to us, asking for a little bit more coverage of it. So let's have a look at some of the text from the actual consultation document itself. Now, this is the second consultation on public health legislation. The first happened in 2015 before the so-called pandemic, of course. But they are taking sort of, they say they're taking sort of lessons learned from the pandemic to inform this consultation. And it says domestic regulations may be made for the purposes of preventing, protecting against, controlling or providing a public health response to the incidence or spread of infection or contamination in Northern Ireland, whether from risks originating there or elsewhere. Now, this is on page 47, it begins, of this document. There's a whole host of other material here which we're not going to get time to cover today. So I do suggest that anybody in Northern Ireland has a look at this. But it says the regulations may impose restrictions or requirements on or in relation to persons, things or premises in the event of or in response to a threat to public health, and in relation to a person. So we'll just look at what they say about persons. The regulations may impose a special restriction or requirement, such as requiring a person to submit to a medical examination. Sorry, we'll go back there 1 second. To submit to an examination, be detained in a hospital or other suitable establishment, keep a person in isolation or quarantine, require a person to be vaccinated or to receive other prophylactic treatment, a person to be disinfected or decontaminated, require a person to be vaccinated, sorry, that's a duplication there, that the person provide information or answer questions about the person's health or other circumstances, that the person's health be monitored and the results reported, that the person attend training or advice sessions on how to reduce the risk of infecting or contaminating others, that the person be subject to restrictions as to where the person may go or with whom the person has contact, that the person abstain from working or trading. And as I say, a whole host of others about places and about organisations as well. And then at the end of that section, it asks a question. This is question 28. Do you agree or disagree with the proposed restrictions and requirements that may be included in health protection regulations? Please give reasons for your answer. So that is just one aspect of this particular document. And this is the policy proposals consultation page itself. They say that the overarching principle of the draft bill is to protect the population against various forms of infection and contamination, including biological, chemical and radiological, in addition to infectious diseases, which is the focus of the earlier Act, the 1967 Act on this. The all hazards approach will enable broader surveillance, support and more timely and effective intervention, controlling the spreading of infection and contamination generally, and if needs be, in an emergency. Now, of course, the emergency legislation which was imposed during the COVID period itself contains very similar restrictions, but that was temporary legislation, emergency legislation put in place for a restricted period of time. And it is true that in Northern Ireland that was longer than for the rest of the UK. But nonetheless, what this seems to be doing is putting this in place at a time when there is no public health emergency, and therefore this is not emergency legislation. It enables emergency restrictions without having to put through any kind of emergency legislation at the time, and it's being consulted on. So we would urge people to get involved in that consultation. Debbie, very briefly, what are your thoughts on this?
Well, my thoughts, good afternoon, everybody. My thoughts are that the COVID emergency restrictions, which were meant to be temporary, are now obviously going to be translated into permanence. And of course, Brian was mentioning New Zealand as well. We need to keep an eye on New Zealand, but we look at a permanence of emergency regulations where they can do what they want when they want.
Yes, well, thank